In America today, a storm is brewing just below the surface of our healthcare system. It affects millions of seniors, and yet it remains one of the most misunderstood and complex topics we face. I'm talking about Medicare. What you don't know could cost you thousands, or even worse, your health. Tonight, we're pulling back the curtain to reveal the shocking truths about Medicare that have been kept hidden for far too long. For over 50 years, Medicare has been a cornerstone of American retirement, a promise of healthcare security in our golden years. But is that promise being kept? The reality is far more complicated. Let us start with a staggering fact. The average 65-year-old couple may need over $300,000 in savings just for healthcare costs in retirement, even with Medicare. How is that possible? It's because of what original Medicare doesn't cover. Routine dental, vision, hearing aids, prescription drugs. All of these are largely on you. That's not a gap, it's a chasm. The system is designed to be confusing. You're bombarded with mail, commercials, and phone calls, each promising the best plan. But the truth is, what's best for one person could be financially devastating for another. The government itself publishes a handbook that's over 100 pages long. They know it's complicated, but the real secrets aren't just in the fine print. They're in the fundamental misunderstandings that are deliberately left uncorrected. Let's shatter the 5 biggest myths about Medicare right now. Myth number 1, Medicare is free. This is dangerously false. Part A, your hospital insurance, is usually premium-free if you've worked and paid taxes for at least 10 years. But Part B, your medical insurance for doctor visits, has a monthly premium that comes directly out of your Social Security check. And that premium can increase every single year. Not only that, but you also have deductibles and a 20% coinsurance for most services with absolutely no yearly cap on your out-of-pocket spending. Imagine a major surgery costing $100,000. You would be on the hook for $20,000. That's a bill that could wipe out a lifetime of savings. Myth number 2, I can sign up for Medicare whenever I turn 65. Wrong again. There is a very specific 7-month window to enroll, called your initial enrollment period. It starts 3 months before your 65th birthday month and ends 3 months after. If you miss this window and don't have other qualifying coverage, you could face lifelong late enrollment penalties on your Part B premiums. For every year you delay, your premium could go up by 10%. Delay for 5 years? That's a 50% penalty you'll pay for the rest of your life. It's a permanent financial punishment for a simple mistake. Myth number 3, all Medicare plans are the same. This is perhaps the most costly myth. You have to main pass Original Medicare, which we've discussed, or Medicare Advantage Plan, also known as Part C. These are private insurance plans that contract with the government. They often look attractive with low or even $0 premiums and bundled benefits like dental and vision. But here's the secret. These plans operate within strict provider networks. Your favorite doctor or hospital might not be covered. And your costs can be unpredictable, with varying copays and co-insurance for different services. You trade the freedom of Original Medicare for a managed care system that can deny services to control its costs. Myth number 4, my supplemental plan covers everything. Many people wisely buy a Medicare supplement plan or Medigap to cover the 20% coinsurance. These plans are fantastic for financial predictability, but they are not a blank check. They only pay after Medicare first approves and pays its share. If Medicare denies a claim, your Medigap plan pays nothing. Furthermore, Medigap doesn't cover things like prescription drugs, long-term care, or dental. You are still on your own for those expenses. And finally, myth number 5, I can switch my plan easily every year. Well, there is an annual enrollment period every fall where you can make changes. Your options can become severely limited, specifically with Medigap plans. In most states, when you first become eligible for Medicare, you have a one-time 6-month open enrollment window for Medigap. During this time, you can buy any Medigap policy sold in your state, and companies cannot deny you coverage or charge you more due to pre-existing health conditions. But if you miss that window or decide you want to switch to a different Medigap plan later, you will likely have to go through medical underwriting. If you've developed health issues like diabetes, heart disease, or cancer, you can be denied coverage entirely. This critical detail is often buried in the fine print. You may only get one shot to get it right, so how do you navigate this minefield? This brings us to the secret supplements and strategies that savvy seniors use. The first is understanding the secret Medigap plans. While there are 10 standardized plans, labeled a through-in, 2 of them stand out for comprehensive coverage. Plan G and Plan in Plan G is the most popular for a reason. After you pay a small annual Part B deductible, it covers virtually all of your Medicare-approved costs. No copays, no co-insurance, it provides incredible peace of mind. Plan N is a close cousin, offering lower premiums in exchange for small, predictable copays for some doctor and emergency room visits. Choosing one of these 2 plans is often the key to unlocking true financial security in retirement healthcare. The other secret is timing. The most powerful tool you have is your one-time Medigap open enrollment period. This is your golden ticket. It's the only time you have a guaranteed right to buy any Medigap plan without fear of being rejected for your health. Using this window wisely is paramount. Now, let's look ahead to 2025. The landscape is always shifting. We're seeing Part B premiums continue to rise. Prescription drug costs, even with the new provisions of the Inflation Reduction Act, remain a major concern. The donut hole still exists, creating a confusing gap in drug coverage for many. The best plans for 2025 will be those that provide the most stability and predictability in this uncertain environment. For most people, this means a combination of original Medicare, a powerful Medigap plan like Plan G, and a standalone Part D prescription drug plan that is carefully selected to cover your specific medications. This triple-layer approach offers freedom of choice in doctors, protection against catastrophic costs, and tailored drug coverage. Medicare Advantage plans will continue to advertise heavily in 2025, promoting new perks. But be cautious, investigate their provider networks. Read reviews about their claim denial rates. Remember, a $0 premium might hide thousands in potential out-of-pocket costs and restricted access to care when you need it most. The system is complex, but it doesn't have to be overwhelming. Knowledge is your shield. By understanding the real costs, the critical deadlines, and the strategic choices available, you can dismantle the fear and confusion that the industry profits from. You can take control of your healthcare future. Don't let a simple mistake or a clever marketing gimmick dictate the quality of your retirement. Your health and your financial security are on the line. The information we've shared today is just the beginning. The world of Medicare is constantly changing, with new rules, new costs, and new plans emerging every year. To stay protected and informed, you need a source you can trust. Subscribe to our channel. We are committed to bringing you the unfiltered truth, the latest updates, and the expert analysis you need to make the best decisions for your future. Click that subscribe button now, and together, let's ensure your golden years are truly secure. Thank you for watching.